When you're feeling under the weather, chances are you're headed straight to the doctor's office. But overall medical diagnosis is easier said than done, especially when it comes to your mental health.
Been saying that about Mike for years. So can medical doctors even tell exactly what's going on inside of your head? Our next guest says he has a breakthrough technique, and he's here this morning to share it with us.
The Kalish Method has already helped thousands of people reclaim their individual wellness, and Dr. Daniel Kalish himself joins us now to explain. Doctor, great to have you.
Thank you, Doctor.
Okay, so you have a very newfangled nutrition plan, which is you have to sort of see into people's brains and their brain chemistry before you can figure out how to fix their depression, their fatigue, and their nutrition problems. How do you do that?
Exactly. There's a breakthrough technology. It's like an X-ray would be for a broken bone, but we're now able to take a map or what I call a mind map of the actual brain chemistry in action while it's being
How do you do that?
processed.
It's an X-ray of the brain?
It's done from a urine test. Very simple urine sample, and it measures serotonin and dopamine levels in the urine, and from that we can extrapolate what's going on with the brain.
So some of the things, you talk about the big five, the things you're looking for here. Let's start with fat. You're looking for what? Fat deposits, fatigue?
Oh, no. When people's brain chemicals are low, they crave sugar, carbs, and compulsively overeat.
And
they just can't stop.
These are the things that can lead to it. So if one of these chemicals is low, we hear about when people get a lack of sleep, they tend to overeat.
Exactly.
So when the brain is functioning in that way, trying to produce these extra chemicals, we just want to chow down?
Yeah, and if you're stressed, if you're not sleepy enough, if you're working too hard, then these chemical levels drop. And the work that I do involves a lab test so we can calibrate these chemicals and bring them back up.
Okay, so I have belly fat, I'm tired all the time, I'm depressed, my hormones are going crazy, and I have gas.
It's not pretty. It's not pretty sitting
That's
next
the
to
big
my
five,
body.
all the big five.
I'm a mess.
Yeah,
I'm a mess.
This is America. This is the American population.
So you want me to go pee into a cup, and then what are you going to determine from that?
Take some amino acid supplements, pee in a cup, we measure the chemical levels, and then we customize a program and recalibrate it so we fix the system.
What does the program then look like? So then if you got Mike's kind of issues, all five of those things, and how do you then begin to, first of all, you have to assess it so we don't know the end result, but what sorts of things are you then giving him to balance those things out?
It's very simple. There's two amino acids. One's called 5-HTP and one's tyrosine. Don't try this on your own because you wouldn't want to try this on your own. But if you test accurately, you can basically get the exact right amount for your system.
You're going to give me a pill?
Yeah, it's all in a supplement.
A supplement?
Yeah.
Right, but can
Natural
you do
supplement.
this just from eating better? I mean, can you find this sort of nutrition and amino acid just from your diet?
No. I don't think people can anymore. If you look at what people are actually eating and how stressed we are, I think we've crossed over past the point where people can sort these issues out on their own. That's why 60% of the American population is overweight, right? I mean, clearly it's not working what we're doing now.
It almost sounds like an MRI because you're mapping the mind.
Exactly. It's like an MRI takes a picture of the structure of the brain. The mind mapping testing I do takes a picture of the actual chemicals in the brain in real time.
Kalish Method?
Kalish.
Kalish.
The Kalish Method.
He has
Thank you.
issues as he's trying to
tell.
Yeah, it's a memory problem.
His memory is gone.
Right,
Doctor, help him.
I have the big six.
If you want to,
We've got a truckload coming in for the Fox News staff. So.
Oh, good. If you want to find out more information about how to do this for yourself, go to foxnews.com. We have the whole links up there.
FoxandFriends.com. You can find out more about the Kalish Method. Dr. Daniel Kalish, thank
you
so
very
much
much
for coming in. Great to talk to you.
All right, what's the old line? If you have nothing good to say, sit next to me.